Hi, my name is Cheryl Ross, and I am here to talk to you about nurse suicide. I entitled my talk, Shh, Don't Talk About It. The reason why I chose this title is because I have known nurses in my career who have committed suicide. We're always told to be kept quiet about it, don't talk about it. It is becoming more of a problem. It has gotten even worse since the COVID pandemic, and it is finally being looked at and studied. A recent study done by University of Michigan that just got published in 4 of 2021 determined that the incidence of suicide, and this is between 2017 and 18, was for women in the general population 8.6 out of 100,000, but for women nurses, it's 17.1 out of 100,000. For males in the general population, it's 32.6 out of 100,000, and for male nurses, it's 31.1 out of 100,000. So female nurses are more likely to take their lives, twice as many as in the general population of women. Well, there's several risk factors to a nurse taking her own life. It starts out with burnout, which we all know about. So working overtime, working in a stressful, non-supportive environment, increased ratios to patients, higher acuity, longer shift, more common in the hospital than the clinics, and then post-traumatic stress disorder or post-traumatic stress syndrome also occur before the suicide. That would be low support in the workplace, longer shifts, higher acuity, generally a female, younger nurse, frontline workers such as the ones that worked with COVID patients, presence of burnout and fatigue. So this is the next step. Some are those that are new into nursing with little experience or new into the experience of the unit they've been sent to. Nurses, more than any other team members, more than the doctors or anyone else, the nurses. Lack of confidence in their protective equipment, lack of confidence in their administration, if they already have a history of depression, PTSD, or they don't have good coping or self-care skills. So burnout can lead to compassion fatigue and empathy distress fatigue. So we nurses are naturally compassionate people, but we have empathy for others. And when people become burnt out, they lose the empathy. And it is also more common, the longer you're a nurse, that you have less empathy. Risk factors for suicide, the most common ones, that when they looked at the women that committed suicide were shift work, off hours, not days, management issues, they weren't being supported well by their administration, lateral violence, and that's often with their colleagues, conflict in the workplace, so maybe they're not working in a cohesive unit and the nurses aren't good to each other, and inadequate preparation for the role. So the new nurses that are getting thrown in, or a nurse that has been floated to the ICU who doesn't usually work in the ICU. And most commonly when they look back, something happened, an incident that made them feel bad about being a nurse. So what can we do? We can learn to identify the risks that lead to suicide, and we can try to help our nurse colleagues. So look at those risk factors for PTSD and increased stress. So once again, the high acuity areas, the newer team members, the younger nurses, the lack of confidence and lack of emotional support in and out of work, longer shifts, high acuity. They already have a history of depression. But we also need to look at risk reduction strategies. So that would be offering flexible work schedules, using sleep hygiene, having good family support, having good coping mechanisms, a very supportive management team, self-care, work-life balance. We can implement self-care within the hospital. People can see a therapist. As we all know, you don't have to be mentally ill to see a therapist. Anyone could use someone to talk to sometime. And here's a chart. This shows what these self-care things we need to do for ourselves. Some of them we hadn't thought about. Financial is important. We just went through this pandemic. What if you didn't have some money in the bank? What kind of stress would you have been under? Emotional. We need to give ourselves a break. We need to have a hobby, practice positive self-talk, meditation, we know helps us with a lot of the stress chemicals in our brain. Having time to get together with our friends, a spa day, physical, all of it, nutrition, sleep, meditation, exercise. Exercise, if you only pick 2 things off this board, if there's only 2 that you could do, exercise and meditation would be really good. Spiritual, whatever that is to you, whatever your spirituality is. Be forgiving, volunteer, help those that need help. Recreation, get out of town, go away for a weekend, do a staycation. Social, it's really important to have social interaction with people. I often thought it was nice to get together with my colleagues out of work and just to be together out of that environment and intellectually keep creative. So risk reduction, productive strategies to reduce post-traumatic stress syndrome, post-traumatic stress disorder. So we know that people that had more flexible work schedules, who got good sleep, had good family support, had a strong social support in the workplace, had a part in making the decisions of what goes on in their unit, if they were adopting to good coping mechanisms, if they could step back and take a breath and distinguish an anger before they say something mean to somebody. Supportive administration and management is really important. A team approach within your unit if you guys can really get along and help each other. Self-care, work-life balance, take a vacation. Mentoring new nurses that come to work and teaching them at that time how to self-care. Assign a chief wellness officer to assist staff. This has been happening at a lot of bigger organizations, that they're assigning a wellness officer to start with people when they come to work to help them get off on the right foot, and that everyone has someone to go to. The other thing I wanted to tell you is, as nurses, we do have a voice. We're powerful. They cannot work without us. We need to stand up for ourselves and speak out. Here I have some resources for suicide prevention. Of course, if it was immediate, it would be 911, but we have the National Suicide Prevention Lifeline, which also has a crisis text lifeline, and then the American Foundation for Suicide Prevention. And then there's a program called HEAR, which stands for Healing Education Assessment Referral Program. It was started out for physicians, and it is now for physicians and nurses, so it's for providers. And they're very helpful, and they will direct you in the right direction. And my last page is my reference sheet, and thank you very much for listening to this cause. It's very close and dear to my heart. Thank you.